Good evening, all. Thank you so much for joining again today. As you all know, that today we have World's Hepatitis Day, and hepatitis and anything related to liver is very crucial for all of us because I think liver is one of the most important organ in our body, and only Ayurveda is having a permanent solution, or if you say a long-lasting solution as far as liver disorders are concerned, hepatitis, jaundice, fatty livers, many other. Till in fact, many times we have seen cirrhosis also being reversed or sometimes managed by certain Ayurveda protocols. And who else will be better on talking on liver disorders uh, as Maharishi Ayurveda, because they are the global leaders in many aspects. And we are very much pleased to have Mr. Anuj Kumar, who is heading the entire marketing in Maharishi Ayurveda. And he is a deadly combination of allopathic pharma experience and now working exhaustively in Ayurveda. So welcome Anuj again on our platform.
Thank
I
you so
think you
much.
need no introduction on our platform now. You are already very popular and very famous as a speaker on our platform, as we have done so many webinars prior as well. So thank you so much again for joining, and we are looking forward for another informative session from you. So without wasting much time, I will hand over the session to you, and I request all the listeners and all the doctors who have joined today, please feel free to ask any questions, any queries you have, and we will be happy to answer that as we will go towards the webinar today. Thank you, Anuj. Please hand over the session. Thanks.
Many thanks, Dr. Piyush, and special thanks for getting the platform of Indian Vedyas for us, Maharishi Ayurveda. At the outset, let me wish once again the entire Ayurveda fraternity and all the doctors that are listening us live on the platform of Indian Vedyas a very happy World Hepatitis Day. So every July 28th of the month is kind of booked by the World Health Organization for creating awareness for this deadly disease, I think. And as per the WHO data, every 3 seconds, you know, at least one person dies on this planet because of hepatitis. So we can all imagine that how serious and how important this condition is, and without medical intervention, and that too without Ayurveda, it is very difficult to treat, right? So without wasting much time, let me go to the presentation. And I hope Dr. Piyush is this visible to you? Piyush, Dr. Piyush, is this visible?
Yes, please proceed.
Great. So the topic that we have chosen for today is liver diseases and Ayurveda, and I would straight away go into the presentation by seeking the blessings of our guiding light, Maharishi Mahesh Yogiji, who was a strong proponent of Ayurveda, and not only in India but globally and worldwide. So Mahashiji always believed that Ayurveda has the solution for all the problems that the humankind has. And we also remember very fondly the founder and our mentor Sri Anand Srivastavaji, who was also a very strong proponent, in fact, of Ayurveda, and who championed the practice not only in India but globally, Europe and US and worldwide. So the disclaimer that for the webinar is that the information in this webinar, we don't intend or we don't imply to be taken as a substitute for a professional medical advice, diagnosis, or treatment. You are requested to seek a medical advice from a registered medical practitioner if you have any issues. So World Hepatitis Day is celebrated, or rather, is conducted on 20th of July every year, and this is done primarily to kind of get the attention of the entire medical fraternity, as well as the patients, the larger population, and everybody else. So if we look at hepatitis, right? So it is inflammation of the liver primarily, right? The swelling in the liver that happens, and this primarily happens because of a viral infection. So there are various types of what do you call various types of liver virus that infect, and A, B, C, D, and E or hepatitis are the main one, right? And if we look at if we look at the hepatitis A, C, D, and E, these are the five main hepatitis viruses, right? And what is important to note here is that the vaccines are available for some of the uh, hepatitis like A, B, C, D, and E. But for the hepatitis C, still there is actually no vaccine that is available as of now. And if we look at the cases that the worldwide, if we look at per year, hepatitis B and C, they account almost 70 to 80% of the cases of hepatitis globally, 400 million cases. And death, if we look at 1.4 million people die every year. And 90% of the hepatitis C patients can be healed within months, but if the diagnosis happens at a very early stage, and if the treatment is also given at the right time to the right patients. So looking at the various modes through which the virus is spread is hepatitis A and E, lack of good hygiene, contaminated water, and substandard stationary sanitary facilities. So because of the washrooms and the toilets and all, the hepatitis A and E is typically spread. Hepatitis B, C, and D, on the other hand, if you look at, it is primarily through a blood transfusion, be it a needle, be it a transfusion, or be it anything that comes in contact with the blood, and this kind of, then the person is infected. Sexually transmitted diseases also plays a vital role in the transmission of Hep B, C, and D, because sperm and other body fluids is kind of contaminated while having a physical contact with the other person. So this is primarily hepatitis overview, and this is a very big global health burden. And WHO says that if not treated and kind of taken care of, it can balloon into a very big problem in the years to come. And if you look at key symptoms, so yellowing skin and of the eyes, there's a dark urine that happens, stool, the color changes, nausea and vomiting is very often there, and one of the primary markers is the loss of appetite, and then there's extreme fatigue. So all these symptoms are very very prominent in the patients with hepatitis, and then the majority of the population with hepatitis, so hep C is one in which 70 to 80% of the people, they do not show any symptoms. So it becomes a very very challenging scenario for a medical practitioner to correctly diagnose such patients, because if diagnosed late, hep C can be very lethal and can be fatal. So if you look at the current stats that the WHO has on their website, close to more than 11 lakh people die because of the Hep B and C infections. And in terms of the treatment for the chronic Hep C virus infections, close to 94 lakhs people, they are receiving treatment, and out of which 10% of people who have chronic infection with Hep B virus are diagnosed, and 22% of which receive treatment. So you can very well see that the percentage of people who are diagnosed and who receive treatment is a very minuscule part of the overall what do you call disease burden. And in terms of children also, the situation is very alarming, because 42% of the children globally, they have access to birth doses of hepatitis B vaccine, right? So you can imagine that more than 60% of the children that are born globally, they do not have access to the vaccines of Hep B, right? So this is a very alarming situation. And if we look at Ayurveda, right, Ayurveda has a very larger role to play in management of the liver diseases, especially uh, hepatitis, jaundice, non-alcoholic fatty liver diseases, and others. Because Ayurveda has a solution, not only solution but also a cure if treated right time with the right doctor and the right advice. Uh, Certainly, it can be cured if the treatment is taken in the right way. And Maharishi Ayurveda has always been a champion in the domain of identifying the white space in which the in which newer medications can be launched. And Livomap certainly is one of the products that has been there for almost more than a decade in the market, and for conditions like for chronic liver and associated diseases, this product LivoMap works fantastically well. Two SKUs it comes. One is a tablet form, which is in a 500 mg blister packing. A strip contains 10 tablet and a syrup of 200 ml. It is a powerful hepatoprotective because of power of 28 herbs. Punarnava, Katki, Bhumi Amla, Giloy. It also has neem, right? So it is a very powerful hepatoprotective, and it also acts as a rejuvenator. So it re-enlivens the liver and kind of regenerates the cell, balances the triglyceride levels in the body, because of which the in because of the viral infections and others, the levels are shot up. That also is balanced. In Ayurveda, typically it is known that the pitta, which has been aggravated because of the liver problems, that is also being balanced with the help of LivoMap. And then one of the key benefits of liver, as we all know, is that a healthy liver is a hallmark of a healthy digestive process, a healthy entire digestive system. So, if liver is corrected, liver imbalances are corrected, it stimulates appetite and promotes entire pathway of digestion. So, in Ayurveda, we call LivoMap as Yakrit Rasayana. Yakrit is liver. In the dosage form, if you look at 1 to 2 tablets BID or TID, depending on the situation. Syrup, 1 to 2 teaspoonful, 5 to 10 ml, BID or TID, and various indications that we can look forward to using LivoMap, and doctors have kind of used in their patients, have prescribed for a very long time and got very good results. NAFLD, non-alcoholic fatty liver disease, on which we have a clinical trial also, viral hepatitis, jaundice, anorexia, dyspepsia, alcoholic liver disease. So in all these indications, I think if Dr. Piyush and other doctors who have used LivoMap, it works fantastically well. And this is a clinical trial which was conducted at All India Institute of Medical Sciences, Delhi. And this was a double-blind, randomized, placebo-controlled trial of LivoMap in the indication of NAFLD. And the objective was primarily to measure the efficacy of LivoMap in NAFLD patients, and also to understand the safety profile of LivoMap. So we had total patients of 58, and the mean group was chosen at 43 years, primarily because this is the time frame where a lot of alcoholic liver diseases and liver profile kind of dips down. So mean age group was 43 years. And if you look at the results, all the baseline investigations were similar in the both the groups, LivoMap and placebo. That means both the groups started at the same level. But the benefits, if you look at, there was a significant reduction in the hepatic steatosis, which is inflammation of the liver, significantly, P is 0.001. And there was a greater reduction in the TG levels, and also in the abdominal pain, because whenever there's a inflammation of the liver, there's abdominal pain and there are abdominal cramps. So in those conditions also, LivoMap showed significant results. So this is one of the very good findings that we had through the clinical trial conducted at AIIMS. And some of the ingredients, if we look at, Punarnava is a hepatoprotective and a diuretic, because the urinaries, the excretory system, primarily through the urine, the excreta and the waste products have to be removed. Bhumi Amla, we all know that it is a potent liver tonic. Kutki is a hepatoprotective. Harad, we know that it tones up the entire digestive system and helps in the Deepan and Pachan. Daru Haldi is another great ingredient which potentiates the entire digestive system and enhances the metabolism. Sont has carminative and digestive properties. So I think LivoMap is one key product that fits in the today's session of World Hepatitis Day. And this is one product which I think any doctor, any Vedya, if they have used it, and I'm very sure with the quality of Mashi Ayurveda products, we are known to cut no corners in terms of the quality of the products. So I think the results, the benefits will speak for that. And we also have a clinical trial supporting the evidences of LivoMap. So I think, Dr. Piyush, many of the doctors, if they want to reach out to me directly, my number and my email ID is there on the screen. And if any further information, or if any Vaidya or a doctor wants a clinical trial, a detailed clinical trial of LivoMap, or for that
Right.
matter, any of the products, right? I will definitely be happy to share that. Yeah. And this is a kind of uh, brand that is known by many of the doctors, and I've met many of the doctors during my field visit in different parts of the country, and they say that the amount of ingredients that we have put is simply good. And the first thing that you notice whenever you take Levomap, and I have taken personally, is that when you gulp it down, within few seconds you will get a burp, in signifying that it works very nicely, right? So, I mean, nothing better than Livomap. And I will request all the Vedas and doctors, if you have used it, thank you so much for your help and using the brand. And if you have not used it, please use it, try it, and I'm very sure that you'll get very very good results, especially in viral hepatitis and NFLD and other conditions related to liver. Yeah, Dr. Piyush.
Yeah, great, great. Thanks, Anuj, and I'm very much excited to share this that right now around 400 doctors are watching you live, as per our overall 8 platforms we are right now live, and it's a very motivating number for us as well. On continuous basis, we are getting this much of response. So thank you so much again. It was a very nice, informative, crisp, and short discussion and presentation about your organization, about the product. Definitely, we have already used that in our practice in our clinic, and we have seen very good results. A couple of queries are there, Anuj, which we need to discuss quickly. One is as far as the dosage are concerned of Livomab. So, what exactly is, as per the company experience, you have shared the clinical trial data, but the practitioners need to understand that, for example, we have cases where generally we see in clinic normally the LFTs are raised, SGOT, SGPT, bilirubin. So what do you think, as per our experience, that I can share that we generally using 2 TDS, 2 3 times a day. So maybe any other doctors or fraternity has shared some feedback with you, so you can have some more insight on that.
Yeah. So, Dr. Piyush, that's a very, very good question. In fact, why I say that's a good question, primarily because uh, this condition is a very challenging condition, and there's no concept of a stat dose, that you can give out, right? Mentioning that it's one or two tablets BID or TID. It all boils down to the liver function test of a patient. What is the liver profile of the patient? Yeah. Basis that, I think you have very rightly said that you use TID, two tablets CID or BID, right? So it all boils down to the current condition of the liver of the patient. In mild to moderate cases, Dr. Piyush, whatever I have learned from Vedyas who have used LiverMap very successfully, is that 2 to 3 tablets BID is more than enough. So usually they say 2 tablets morning and 2 tablets in the evening. With syrup also the same thing. They say 2 teaspoonful, 5 to 10 ml, 2 times a day is more than sufficient. But in little, kind of a chronic cases, in serious cases. So I had a meeting with one of the Vedyas in Bangalore. So he said in liver cirrhosis, yeah, he used 3 times TID, 2 tablets in the morning, afternoon, and in the evening. And with the syrup, he said he gets a very beautiful result because of the simple reason that the bioavailability of syrup is much better and faster as compared to a tablet, right? So, I mean, 3 tablets also, TID is also very well accepted. There's no side effects. There's no, kind of other complications that you typically see with the other medications. So, I think, but more than that, Dr. Pish, how, as a Vaidya, you have also used Levomap, right? How do you titrate the dose basis the patient? I mean, you surely will be seeing the uh, liver profile of the patient, right, on the reports and all, if I'm not wrong.
Absolutely, but what we have seen is, see, again, grade 1 to grade 2, sometimes 2 BD is absolutely fine, and we have
Yeah.
given in combination also along with the syrup. So 2 times 2 spoon syrup, and it will be working fine in grade 1 to grade 2. But yes, if it is going to grade 3 or reaching the stage of cirrhosis, as you correctly mentioned, or SGOT, SGPT, or bilirubin level are multiple times high, so then sometimes we need to focus, and we used to give 3 times a day, because then we need to check certain aspects. Now the second aspect is alcoholism. So many people who are already addicted to an alcohol, and they are sometimes we try to de-addict them or withdraw the alcohol levels which they are taking, but sometimes they are not. So at least to protect and to further hold the damage. We have given 3 times as well. And so yes, we have seen, and few other medicines along with like Livomap, we have seen are working very well in terms of if there are some infections, some viral infections, and so on. But yes, again, an excellent product. And the best part which I want to emphasize and which want to convey here is in Ayurveda, with due respect to many companies, we need to sometimes use multiple products. And it's not about Livomap, by the way, your all other products as well. So for a specific indication, we can maximum use 1 or 2 products or medicines from Maharishi Ayurveda, which is the best part because we can replace them. Like for example, Amlant we are using as an excellent antacid, or sometimes for gastritis, and they are just replacing that with their like whatever the pill they were taking, and the same dose they can get from the Ayurveda medicine, which is a very beautiful and very good manner to introduce Ayurveda in an individual's life, because then they are able to take it, and we all are busy with our lifestyle, with our, especially after this pandemic. Now again people are starting and getting involved in their professional life, so they are not that much free. So if it's anything which is just 1 or 2 tablets or 1 or 2 spoon morning, evening, and that is sufficient to address and check the health issues, that we need to understand. And I think Maharishi, all the medicines of Maharishi deliver in that aspect very well, with whatever the composition, the potency, the extract combinations you people have. So I think that is one important aspect as a clinician we need to understand, and accordingly we need to infuse that in our practice.
Dr. Piyush, there's one query, which many of the doctors ask me, and I think surely you would have also got some feedback from the patient, is that syrup, our Livomap syrup, if you look at, right, it is little bit bitter as compared to the competitors, right? So I mean, many of the Vedyas have told me that, can you make it little sweeter? Can you do something about this, right? So and the answer also have come from many of the Vedyas, right? So the problem is that if we do, and many of the competitors, with all due respect to them, a lot of sugar content is being added to make it palatable, right? Because obviously, when you have kutki, when you have neem, these are known to be very
Bhumi Amla
bitter.
and all.
Yeah, bhumi amla and all, they are known to be bitter in taste. Yeah. So many of the competitors and many of the brands that are there in the market, they taste very sweet, right? They taste very palatable. So but what on the other hand we are doing is we are compounding the problem. Yeah. So how do we are doing that? Because we are uh, kind of burdening the liver more, because the synthesis, of the sugar, you know very well, and many Vedyas know very well, it kind of burdens the liver very very much, right? And especially the white sugar. So even in the sugar there
Right.
are multiple grades. Yeah. So if the grades of a sugar that is used is, more, like a sulfur treated one. Yeah. So it might taste good to the tongue, but at the end of the treatment, it is doing more harm to the patient rather than good, right? So we at Mahasi Ayurveda, we don't do that, right? So many of the Vedyas have said that, it is really good that you have not made it much sweeter. Yeah. So to all the Vedyas and the doctors and the patients and consumers who are listening us, and who think that our product is bitter, is for a simple reason that we do not want to, cheat you with a kind of a false promise that if you take a sweeter, it might be palatable to the tongue, but at the end of the day, it will kind of worsen the condition of the liver. So I think that is one of the key things that we need to note. And
No, in
otherwise,
fact, yeah, sorry to interrupt you. In fact, we
yeah,
need to also understand that whenever some company is having a good potency of extracts and good potency of herbs in any medicine, it will definitely by nature will get bitter. That is point number one. Second,
absolutely,
when we are adding some kind of a sugar or some kind of a masking agent, that will again increase the burden on liver in terms of the digestion and in terms of the metabolism, which is already impaired. And we don't want to overburden our liver, because we want to heal our liver. So that is the thing which we need to understand. So the point is, as maximum raw, as maximum crude, as maximum additive, chemical, masking agent, sugar, and all these things free syrups or tablets, or sometimes in fact we have seen not that much of sugar coating or not that much of masking is required as well. So these things are very small things, but you have correctly mentioned and raised this point, and as a clinician also we have seen that those syrups and those tablets are working better. And sometimes patients are also understanding this aspect, and it again entirely depends on doctor, how you are counseling, how you are doing the counseling, and ultimately end of the day people are looking forward for results. People are looking forward for quality treatment and the efficacy. And if it is decreasing in their reports, in their LFT, in their ultrasonography, they are seeing the improvements, and in their clinical symptoms as well. Nobody will mind having a bit bitter syrups as well these days. Again, it's just a mindset, and in fact, many people are living sugar-free life. Many people are adopting this bitterness in their life just to ensure that they are healthy. So I think this mindset we need to infuse and impart in all the people, and accordingly, it can take it forward.
Absolutely, absolutely. And Dr. Piyush, one more point that I like to add to whatever you have said. So we at Mahashaya Veda also have a philosophy, and I think Chairman Sir was a big proponent of that. That more is sorry, less is more. So it's not that you add 100 and herbs and then say that we have 100 herbs in a preparation, right? It's not that the quantity of herbs is very important. It is the right synchronization, right, synergy of herbs that is important, right? So a brand like Cardimap, it has only 5 herbs. So if you tell somebody, many of the Vedas ask me, can these 5 herbs help to mitigate the hypertension, which is a very challenging condition, right? So many of the Vedas get surprised that only 5 herbs beautifully managed a challenging condition. So what I'm trying to tell Vedyas and the consumers who are listening to us is that we at Mahashaya Veda at no point of time want to burden the consumers, the patient, and the doctors also, right? Because it's not the philosophy of our company. It is the right thing that we give to the consumers. And whatever formulation you take, Iodefense AV, you take uh, uh, Amrit Kalash, you take Kasmi, whichever brand you take, right? It is the disease which is kept in mind. Otherwise you see in the market, many of the brands, they claim that we have 101 herbs, for fortified with 153 herbs, right? So that has never been the philosophy of the company. The philosophy of the company is to create a disease-free society. The vision is that of Mahashiji, and we kind of champion that cause by giving the right treatment and the right medication to the patient. That's it. And certainly we do not want to burden the patient in terms of the extra things. Yeah.
Right, right. Great, Anuj. Thank you so much. I think it was a very nice and informative talk we had today. And again, thank you that you have pulled time from your busy schedule. We know that you are a busy man. So thank you again. And we thank Maharishi Ayurveda, and we are getting some queries. So I request doctors to just rewind the session a bit. And Anuj has shared his contact details, number, and email ID. Otherwise, you can write us at info@indianvadyas.com. We have already connected many doctors, and we are getting Anuj this query from Hyderabad, and we are getting from some other cities as well. So I have okay, just a second. There's some typo error. Yeah, I have now shared the corrected email ID with all of you. So you can just mail us on that email ID, and accordingly, we'll be able to help you out in terms of your queries are concerned. And please feel free to mail us with all your queries, and we will be connecting you with the respective companies as far as getting their medicines and products in your clinics. And Anuj, we are looking forward to have many more sessions with you, with your team.
Sure.
You have a nice team of doctors as well. Please bring them on these sessions as well along with you, so that more and more doctors will get benefited with the experience of Maharishi Ayurveda, the pharma, and as well as the uh, uh, like the hospital setups you people have, and you are doing a tremendous job. So thank you so much again for joining today, and I thanks all the doctors for pitching in and joining this session on a very short notice. It's very encouraging to get hundreds of doctors with a very short notice. So thank you so much, and we are looking forward to have many more sessions with Maharishi Ayurveda and with you, Anuj. Thanks.
Many thanks. Jai Gurudev.